Obviously, contraception is critical at the time of medical termination. Our aim is not to have this woman present again, and that can only happen if she's offered effective and almost immediate contraception. All contraceptive methods, apart from IUDs, can be offered at or soon after the medications have been taken. So at the time of termination, on the day of the first tablet with the doctor, an implant rod can be inserted. A day or two after the second tablets have been taken, a woman can initiate the pill, the contraceptive pill, both progesterone only and combined, and the vaginal ring, and she can recommence condoms if that's her choice. Depo-Provera is a contraceptive injection. There's some evidence that because it has a high hormonal content, can interact with the first abortion pill. So we tend to not want to provide that shot at the same time as the first drug. The rate of it causing failure of the method is very, very small. So if you're in a setting where you're not sure that you'll see that woman again, but you do want her to have good contraception, and that was her choice, you have that small discussion with her about this tiny risk of it perhaps affecting the effectiveness of the abortion, and she may elect to have the Depo-Provera injected at that time. Intrauterine devices can't be inserted until the MTOP, the medical termination of pregnancy, has deemed to be complete. So that would normally be at the 2 to 3 week follow-up visit, and you can arrange an appointment, a double appointment for the follow-up of the termination procedure and for insertion of an IUD at that time.
So with the surgical termination of pregnancy, essentially all contraceptive choices are available to the individual. So people who want to start the contraceptive pill can start basically the same night of their surgical termination or the following morning. It really just depends on when they'd like taking their pill. And they can start that immediately. And by the time that they've passed the 7 days that we ask them to have no intercourse, post the surgical procedure, the contraceptive pill is immediately effective. The other contraceptive options are all available and actually can be considered an additional benefit of a surgical termination, in that the long-acting contraceptive devices can be inserted at exactly the same time as the termination. So this is something that we would do while the patient remains under sedation. And we do know that the fear of discomfort or pain from some of the contraceptive options can be off-putting to patients, which is why the opportunity to provide it at the same time as a surgical termination is certainly taken up by a considerable number of people. So those options include the Implanon, the 3-year hormonal progesterone-only contraceptive device that we would pop just into the arm, again, while the patient's still asleep. When they wake up, they've already been bandaged and have a dressing on that. And that device lasts for 3 years. They can also then have the IUDs inserted. So what we would do is immediately at the end of the surgical procedure, I do check that the tissue and products have come out of the uterus. I'll perform an ultrasound scan if necessary. And then immediately at that stage, we will put the intrauterine device into the uterus while the patient again is still sedated. And that includes the Mirena, which is the hormonal long-acting contraception. That lasts for 5 years and has quite some positive effects on patients' bleeding. A lot of patients will experience lighter, less painful, and some will experience no periods at all. The other intrauterine device we insert is the copper IUD. The copper has the benefits of being totally hormone-free. So as I say to the patients, it cannot affect your mood, your skin, or any of the things that we can associate with hormonal contraceptive. It does have the slight disadvantage of making your periods heavier for the first 6 to 9 months after insertion, but most patients are able to tolerate that for the benefit of being on a hormone-free contraception. The device that we insert at the time of termination tends to be what we call the TT380 device, and this has a 10-year license. So the patients can leave it in for up to 10 years, but of course, as with any long-acting contraception, can choose to have it removed at any time, and at which point it will stop its effects and the patient can choose to become pregnant at a time that is right for them. Of course, there are still the barrier methods that patients can use, such as condoms and other other ways of contraception that patients like to suggest. However, we are strongly encouraging of long-acting contraception. When the patient's in a situation that they've had an unplanned pregnancy, we're exceptionally keen that for them it doesn't happen again. And we do know that long-acting reversible contraception is essentially the best way for this. Finally, some patients may choose to go on to permanent contraception, which could involve tubal ligation, which should be performed at a public hospital, or a vasectomy, which is also provided at the clinic I work or in many other clinics.